There you go. So it's pinned only on me. So those guys that are new, you can realize that uh, none of you are on the frame, just me during this session that I record, so that um, we can keep this for other guys to watch later and other men to watch around the world. And so yeah, so here we go. Um, there's been so many of you who've been impacted by this particular topic, and I want to open up the door and do some pretty serious instructional teaching on intimacy anorexia. Um, Intimacy anorexia is the active withholding of emotional, spiritual, and sexual connection to our spouse. Um, and and many of you guys here, because you know your journey, you are intimacy anorexics, and intimacy having to do with uh, all aspects of intimacy, not just sexual. And anorexia, we know that word from the eating disorder problem, where women usually, although I've counseled men who are anorexics too, they withhold eating or they do binging and purging. But in this case, an anorexic is one that withholds. And so when Dr. Doug Weiss put this together, he put the words intimacy, anorexia together with the idea of withholding intimacy, withholding connection, and so you'll see in I'm going to put some documents into the chat, and you can grab those as they come. The first one is called the intake. I have another one here called the root scale. And the one that you're going to want to look at is understanding intimacy anorexia. As I work to get it on there. Come on, come on. Okay, there we go. So the one that you want to open up first, guys, as you're able, is understanding intimacy anorexia, and we'll refer to the other two in passing as we go. And so so yeah, um, intimacy anorexia, um, as I said, is the state of where a person actively withholds emotional, spiritual, and sexual intimacy from their spouse. No, it is an addiction because the person is addicted to withholding. They're addicted to not giving themselves, and they can't seem to turn it off. The goal of the anorexic is to create distance. He doesn't want the person to be close to them. Some of the understanding the definition, and you'll see in our discussion here, is active withholding. Active is intentional, and most people don't like to hear the word active withholding because, well, I'm not trying to hurt anybody. I'm not trying to be mean to my wife or whatever. But the point is, if you're aware that she needs something and you're not giving it to her, you can say, well, it's not really withholding. I'm not being intentional. But if you're aware that you are not giving what she needs, even if you're not fully cognizant of it, you look at the pattern and you are actively not giving what she needs. And so your fears, your insecurities have made you addicted to withholding because you don't want to get close, because you don't want to maybe be seen or understood. And we'll get to why. And you see the three aspects are emotionally vacant. They don't show up and ask questions. They don't take an interest. They don't encourage. They don't show love, express love in the way of just hugs and warmth and kind touch and kind words. They don't do any kind of sense of just heart to heart connection. They will actually put up a wall and try to stay distant. And so they're emotionally vacant. They're just not showing up with their spouse. Secondly, spiritually to distant. They may be, in a direction close to God, on their own private life, but it doesn't come across as a thing that they share with their spouse. They don't want to pray together with their spouse because they might have to get emotionally close. So they withhold praying together. They don't share how they're feeling about spiritual things. They don't share about their personal growth. They don't open up spiritually. The outsiders, they might even be an elder at the church. They might be a Bible study leader. And everybody says, oh, what a great guy that Dave Currie is, if I were an anorexic. And we give a public image that everybody says, boy, it must be nice to marry to that guy. Meantime, he doesn't share spiritually with his wife, and he doesn't open up emotionally. Sexually absent is the third aspect. They don't make love. They might have sex, but even sometimes they withhold being connected sexually because the implication, if you're close to somebody sexually, you might have to be close to them emotionally, and they don't want to be close. So often the wife in these situations feels somewhat prostitutized. They're not emotionally present. They're not really engaged with their spouse. They may be having sex with them, but they're looking away, and it's all about their sexual hit, and it's not about connection. I actually got an article partly started here, the difference between making love and having sex, and the person that's an intimacy anorexic, if they are willing to be sexual with their wife, it's not about connection. It's about their sexual hit. And or they might not want to be connected to their wife sexually because they might be connected emotionally. So they might be acting out with porn and masturbation, or they might be acting outside the marriage to have their sexual hit, but not because they want to be close to that person outside the marriage. There's a bit there about the history of intimacy anorexia. And I just think it'd be helpful for you to understand. I'll take maybe just 3 minutes to push through this next section. But the history and even my connection to it, the concept of sexual anorexia was first put together by Dr. Patrick Carnes in the 90s. And it came out in print in a book called Sexual Anorexia, Overcoming Self-Hatred. And he was doing a lot of work with sex addicts and how they hated themselves for what they're doing. So they didn't involve sexually with their spouse, but they might be involved in prostitutes and things. And so, but in many cases, these people were sexual addicts with themselves only, and they didn't involve sexuality with anybody. And so Carnes saw this as sexual anorexia, withholding sex from even your partner. Dr. Weiss and Dr. Carnes were pioneers in the field of the area of sexual addiction. Carnes being a little older than Weiss by about 10 years. And so they both started using the word sexual anorexia in the 90s, late 90s. And after treating couples himself with marital breakdowns, largely due to sexual addiction and sexual unfaithfulness, Doug started putting together some material to help these men avoid, sexual intimacy problems. And so Doug's DVD came out in the early 2000s of the 9 characteristics of the sexual anorexic, which of course he later changed to intimacy anorexia. The term sexual addiction and the term sexual anorexia, intimacy anorexia were often seen as the same for a while, but only later the term intimacy anorexia was what Doug called it, because he saw it was emotionally withholding and spiritually withholding too, not just sexual withholding. And so he broadened the term in the mid 2004-5 to include intimacy anorexia. In 2005, Doug was on my TV show, and the first time he mentioned the words intimacy anorexia in Canada. And we have vintage footage from 16 years ago of Doug and I together on a TV show talking about intimacy anorexia, which of course were new words for me 16 years ago. Doug did put a DVD out called Sexual Anorexia, later retitled Intimacy Anorexia, as he changed the book in 2010. His book, Intimacy Anorexia, and the workbooks, they came out in 2010. The Married and Alone DVD, What It's Like to Be Married to an Intimacy Anorexic, was 2013. They started some training in ASAT in 2016. And then in Canada now, I'm one of 2 intimacy anorexic therapists who've been trained. There's only 9 in the world that have been trained by Doug in intimacy anorexia. We don't need to hear about my training. But anyway, so so there's a bit of the history of the development. It's relatively new on the field of understanding. And by the way, it's not a diagnosis. It's a paradigm of operation. It's not a diagnosis like schizophrenia or social deviant or something. It's how people operate. Okay, it's their mode of operation. And let's look at some of the causes of intimacy anorexia. You see, how does a person become an intimacy anorexic? And you might be saying, "Gee, am I one of those? What does that mean?" And so I'm going to do my best to explain some of the history of it. First of all, you'll see their family attachment issues, and this is a good illustration. I want to have this on record, so I'm gonna do it here. So stay with me. It's about a minute illustration. So Sasrikal. Kihala, Teranam ki Meranam Devi, Rabraji Ruke, Christmas Mubarako. Now, if you're fluent in Punjabi, you'd say, "Oh man, Currie can speak Punjabi." Now I can't. I just told you everything I know. It's just enough to be polite on the street to a senior that doesn't know English. But I lived in a community that was, about 50% Indo-Canadian, and I just wanted to be friendly to the seniors, so I learned a little bit. But if you didn't grow up hearing Punjabi, you didn't grow up speaking Punjabi, you didn't learn Punjabi, you didn't write Punjabi, no one communicated to you in Punjabi, guess what, guys? You can't speak Punjabi. But it's interesting. If you didn't grow up feeling connection, seeing connection between your parents, you didn't experience close connection, you didn't learn how to connect, you didn't experience or feel it from your parents, a sense of connection and love, you can't speak emotional Punjabi. You can't speak the language of love and connection. You don't know how. And so one of the first issues is just the absence of examples, the absence of connection in your family of origin home. And it doesn't have to be abusive. It just can be not a lot of expression, not a lot of warmth, not a lot of closeness. All right. And so if you have a healthy family of origin, you can have a lifetime of satisfying human connection. But if you don't learn the language of connection, the language of love, the language of closeness, emotional, spiritual, even friendship, love, and everything, you tend to keep walls up and keep people over there, especially when you get married, because that person is required to be inside the wall. And we don't know how to handle that, so we kind of keep them over there. Thus, the intimacy anorexic. So the parents being absent, they're just not around, not showing affection, no appreciation verbalized, not a lot of touch, not a lot of encouragement, or just abuse, where just the opposite. There's harshness. You're a stupid effing idiot. Get out of here. No son of mine. And, or the mom's been, physically, trashing and always criticizing. And so you pull away, you close your heart, because the people that are supposed to love you have actually either not shown an interest, which is the neglect one, or been abusive. They've been harsh, really problematic. And they got problems, your parents, maybe with a drinking issue or an anger issue or whatever. And so you have parental absence, they're not around. You have parental abuse, where it's really harsh, or the neglect. They might be around, but they're really not affirming. They might even be cruel. They might withdraw. They might punish you with isolation and always send you away and reject you. And so those are in the mix. One of the other things too, if your mom and dad's relationship was chaotic or not close or didn't show a lot of warmth, encouragement, and you didn't see a loving connection between mom and dad, that's your pattern. And if you didn't see it, you didn't feel it, you didn't experience it, you didn't learn how to connect and feel safe in connection, you don't know how to do it. And so when you go to get married, you have a problem, because this is a whole new language and you don't do it well. You kind of do it well enough to fake it in the dating season to get, your date, your girlfriend, your soon to be wife. Other things that Doug has found, and Carnes too, is that if there's sexual trauma in the mix, and this is the abuse, because remember, intimacy anorexia isn't just a male problem, it is female too. You might be married to a woman that is an intimacy anorexic, but one of the factors is if a person is sexually abused. Because what happens is sexual abuse of a little person. Most of you know the story in podcast 29. My wife tells the whole story, but my wife was abused for 5 years by her grandfather, ages 6 to 11. And so Dahlin had to get over the fact that people that she was supposed to be able to trust hurt her. So when we go to get married, because she's been through this trauma, she's skeptical about me. She's skeptical about, do you really care, or you just want something, right? Because she's been manipulated, lied to, and hurt unconsciously by someone she was supposed to feel safe with. And so sexual trauma is in the mix. And I've dealt with, 40 or I'm dealing with a couple right now, young men who, when they were young boys, were abused by somebody too. Well, that will be part of the story because people hurt you who were supposed to be trusted people. So that's in the mix. The connection between intimacy, anorexia, and sexual addiction started to, first of all, surface with Patrick Carnes, and then, of course, reinforced by Doug and all his work. But sexual addiction, what happens is when I'm addicted to, whether it was back in the day, magazines or watching a video, or now online, watching pornography objectifies a person. It's not an emotional connection thing. It's all about a sexual hit. So the PMO cycle, porn, masturbation, orgasm, actually objectifies woman. They're just an object for my satisfaction. And so when I go into marriage, it's very common for me to be emotionally distant and even intimately not wanting to be close to my wife, but might be okay to be sexual as long as it's on my terms, doing what I want and that sort of thing. And so yeah, sexual addiction is part of the building of intimacy, anorexia. And so these are some of the factors that are behind the development of intimacy anorexia. Now we got to understand the fact that the impact of the roots of IA. First of all, remember, it wasn't a person's choice. It wasn't like, hey, I'd like to become an intimacy anorexic. Okay, it wasn't that. People don't choose that. It starts with their family of origin, the environment, the lack of attachment, the lack of connection, the lack of feeling love and approval and encouragement and affirmation. And so they didn't sign up. So it's not volitional. I didn't choose this. But it is a pattern of operation that they soon become aware of. Now you become responsible to deal with it. Secondly, it often comes out of a deep soul pain. And the roots of IA have to be in that family of origin. If you maybe were abused as an 11-year-old as well, and you may get involved in sexual addiction with the porn and stuff at 13, do you understand how that deepens and puts the roots really deep? And there's a soul pain there that is being met with, yes, acting out with porn, but also connecting or disconnecting from people to feel safe. And so over and over again, the intimacy anorexic has often some soul pain that they need to deal with. And so at the root, closeness, being close to somebody actually scares them. Now they'll put an image and they might be good group leaders, but they're in control and they can bring people in as close as they want and they can keep their wall up. But the problem is with the spouse, they have to be inside the wall for it to be really healthy. We have to let them into, they have to, know us, they have to love us. And we can kind of, this is a huge fear of closeness. Letting people inside the wall is really scary because at the heart, the intimacy anorexic wants to maintain distance. It wants to keep people at a distance so they feel safe because people that were close to them in the past didn't treat them well. And then they end up being objectifying others through acting out with porn and masturbation. And so what happens is the IA actually doesn't know how. It go back to not learning Punjabi. So you can't speak it. You haven't learned it. And so they really don't know how. And so what happens is, and when you add the sexual abuse thing, where someone was hurt by somebody who was supposed to be safe with them, it just kills the whole sense of being close is okay. Being close was their worst pain in their life because being close to this person that abused them, who they were supposed to be able to trust, really, created some damage. And you can see how porn creates distance because not only does the person feel shame and guilt and embarrassment by carrying this secret growing addiction at 11, 12, 13, 14, etc. But as they get hooked on that cycle, it's all about objectifying. It's all about my needs. It's all selfish. So what happens is I pull away from people because I don't want them to get close to me to discover that I have this problem of porn and acting out. So we say the opposite of addiction is connection, but the IA doesn't want connection. Not with anybody. Doesn't want to open up with anybody, really. But they, as long as they're in charge, or they know where you're at, and they can keep you at whatever distance. But the porn actually creates more distance, because not only does it objectify people, but it causes the IA person who's acting out with porn and all to pull away from people, to disengage from people, to have a secret private life that nobody knows about. Now that's the opposite of connection. Now there is a document called the Intimacy Anorexic Roots Scale that I created. Now, we're not going to take time to look at it today, but I would like you to look at it on your own, because there's 20 different characteristics. The higher you score on these, like, number 4, you might only be, that wasn't true all the time, but you certainly experienced some of that. So you might score a different number, like a 2 or 3. But the point is, the higher your score on this particular scale that I created, the more likely you have intimacy anorexia. So that's the root scale. Now we're gonna walk through this here. If you want to open up the document that says intake on it, if you can. I know that with your phone sometimes it's hard, but you don't need to see me. It'd be better for you to actually look at that scale, because I'd like you, if possible, to follow through with me, because as I explain the characteristics of the intimacy anorexic, I want you to score either yes or no. You'll see at the top of the intake, this is actually what I just did it yesterday with another couple. So this is exactly what I use in my practice. And I put this together in what I feel is a helpful format.
Excuse me, Dave, how do we open that on the phone?
You'll have to learn that on your own time. Sorry, it's just,
okay.
You'll have to double click on it as what you, if you see it there, you double click and it usually opens up. But in any case, sorry about that. So what I'd like you to do, if nothing else, just put yes or no to each of these 11 questions, okay? Because I'm going to walk through them in order of this intake, explaining each characteristic, and then do it with your usual behavior in the last 3 to 4 years, not the last 3 to 4 months. Take a longer sample size, and then also important to if it's 51% yes, then it's yes. If it's 51% no, it's no. You can't be in the middle. It has to be yes or no. And we're only going to do you. We're not going to do your spouse. So the document is, allows you to rate your spouse as well. But right now we're just doing it for you to see if you are intimacy anorexic. So
Dave, sorry, Dave, excuse me. Where can I find that on the Zoom page here?
It was in the chat. I downloaded in the chat. Gotcha.
Okay, thank you.
Okay. All right. So these characteristics here, I want to walk through the characteristics of intimacy anorexic. So number 1, do you stay so busy so as to avoid or not have us time, you and your wife together? You keep yourself so busy, so scheduled. It could be legitimate things like, oh, I just have to work late, or I want to take the kids someplace, or, I'm going fishing or whatever, but there's no time left for us. And you actually prefer being busy than being with them. The spouse is often last on the list, so you stay busy. Number 2, do you blame your spouse for most of the issues between you? Assigning blame is a big characteristic for the IA. They want to be seen as good, so they project, well, she's got the problem, and man, if you would have not done this, what do you expect? How else am I supposed to respond? And so even when she is pointing out something that you need to address, you come back with a level of not only defensiveness, but you point out where it's really her problem, and it's not you. And they don't take responsibility for their faults. They blame others. expressing or suppressing love, not expressing love. The IA withholds love, warmth, and an affection from their spouse. They actively don't show interest, don't show care. They don't come across as kind. There's disinterest. They're not tender. They're not affectionate. They're not given to hugs. And they don't even ask questions about how you're doing on a day-to-day basis. They don't reach out and bless their spouse with full attention. They sometimes walk away and cut them off, and there's just no warmth, no connection. That's the third one. So yes or no on that one, guys. Number 4, denying praise. Do you withhold praise and appreciation from your spouse? Rarely affirm, rarely give approval, rarely show gratitude, no reassurance, total invalidation. We're not giving them, building them up in any way. Withholding sex. Do you withhold sex or are not present when you are intimate? Because what happens is some IAs actually don't even want to have sex or do it kind of obligation, or, because she's pressuring, okay, let's have sex, but he doesn't really want to be there. Or if he is going to be sexual, it's about a sexual hit for him. He doesn't want to be emotionally close. So it's not about engaging. She becomes kind of a receptacle of his addiction, and she feels it. She feels the rejection while sex is happening, because your heart is cold, but your body is warm. And so that's the 5th characteristics, withholding yourself during sex, or actually withholding sex. Number 6, do you withhold spiritual connection from your spouse? Like rarely wanting to pray together, rarely wanting to talk about spiritual things, not wanting to open up about what you believe. And you might be really good with others, might even be a care group leader, worship leader, who knows? But you're not opening up with your spouse spiritually. Number 7, you withhold sharing your real feelings. You hide your feelings. And so you're either unwilling, in some cases unable to share. You don't even have the words to share because you didn't learn the language of emotion. You didn't learn the language of connection. You didn't learn the language of love. So you don't really know how you feel. Matter of fact, feelings scare the heebie-jeebies out of you. So then you just don't talk about how you feel. You don't put your guard down. You don't open up your heart. And yet your wife is wanting your heart, wanting to get to know you. And you have this wall up and prevent because you don't share who you are. And so, there's occasionally they will open up a little bit, but maybe for a week or 10 days, but then they'll shut down again because it's just a scary world for them to open up with their feelings. Number 8, do you try to control your spouse either with silence or anger? And silence is, not talking to them for 3 days, or punishing them with just being distant and emotionally disconnected, and actually not letting words come out of your mouth for a day or 2 at a time, because you're going to kind of punish them or control them or tell them that they can't do that again. I'll show you. And then you punish them by silence. Or you can go the other, where you punish them by blowing up and lighten it up and just being really filled with rage and aggression. And that is another sign of the whole IA journey. And so, is that part of your journey? Number 9, do you give ongoing criticism of your spouse that causes isolation? There's this unending condemnation, constantly picking, pointing out where they're falling short. They didn't, it could even be ungrounded disapproval, but you're just, nitpicking, pointing out things, criticizing, they're wrong on everything. And matter of fact, as you're getting close to going away on a vacation, you might criticize her more and more. Then she goes, well, what's the point of even going? And in your heart, you say, good, we don't have to be close during this vacation, or we'll just do something else on our own. And so the criticism is part of the picture. Very controlling when it comes to money. Now, Doug says when this is true, it's really true, but it's not necessarily true of all IAs. But the question is, do you control or shame your spouse over money or spending issues? Like, why'd you spend that for kind of law? What kind of chopper are you? That was a brutal purchase. And why did you spend? And you control the money. You make them beg for money. You don't give them enough, or you're just always on them about finances. And then finally, the question is, you to mainly live as roommates, not friends and lovers. And so yeah, scoring that, and the one about roommates is kind of Doug's bonus question. If that's the feeling that we're more roommates, not friends and lovers, then that's really really what we're all about here. And so yeah, so there's a bit about the IA and and those characteristics. So take a moment to total yourself up there to see what you are out of out of out of out of 10, even though there's 11 there. Um, okay, take a moment to do that, and it'll give you a bit of a feeling. Just when you know that it's intimacy anorexia, you'll see the inner workings of the IA. And I've just given you a sample here. This is about 2 pages or 3 pages of about a 8-page document that I've created. But this is just to get you guys going to see if this is true of you. But how do you know it's IA? It's exclusive. Number one, means it's focused on your spouse. You can be kind to your kids. You can be great with others. You can be seen as a really engaging, loving man outside the marriage, but with your spouse, she feels this huge gap. And so it is exclusive to her. Secondly, it's effective. You know how to keep a distance. You're good at keeping a distance. And, just as the negative words, the demeanor works to keep the distance, and it's effective, it works. And thirdly, it's endless. It just doesn't stop. The relational gap is maintained, it's repeated, and this consistent negative interaction sustains the distance that you want to keep. And Doug calls it an addiction for sure, because they're deliberately withholding. They can't stop. They simply have to create a distance. They live in fear. And intimacy anorexia is addiction because to withhold love is the opposite of cherish. When we married somebody, we said to love until cherish, till death us depart. But when we perpetually starve them and don't give them ourselves emotionally, we are intentionally withholding, and Doug calls it an addiction. Now, there's a sampling of IA, and I want to just stop here and say that, remember, this is not a chosen thing. You didn't choose. Now you choose to perpetuate it and keep it going, but it was something that was given to you. It was something that was grew in you as you were growing up, and it wasn't something that you actively chose. But if you're aware of it now, and some of you guys, because I know your stories, you're intimacy anorexics, and you have to work through this. Obviously, if we can diagnose this, we can help people through it. But it does complicate things, and you see how it's connected to sexual addiction, because sexual addiction objectifies and keeps people at a distance, and we kind of end up putting our spouse in that category. And so IA and sexual addiction, or SA, they actually can really play on each other. Okay, so there is understanding intimacy anorexia. Score yourself as you have, and just to learn. And then also do the root scale later, which, the more there's the higher number there, the more likely that you really are intimacy anorexic, and you can see some of the roots of it for yourself. All right. So with that in mind, I will put a pause on the recording. And